Coming up this Saturday, this is so important here, Central Texans will put on their walking shoes to participate in the annual Walk to Defeat ALS. ALS is also commonly called Lou Gehrig's disease and affects about 15,000 people in the U.S. every year. So many families impacted by this. So Saturday's walk is set to begin with registration at 9 a.m. at the beautiful Concordia University. And joining me now to talk about this in studio this morning and teach us more about ALS and how it's treated is Dr. Yessar Hussain. And he's actually part of the Austin Neuromuscular Center, which operates an ALS clinic for local patients. And I know you know firsthand just how this impacts so many people. And I'm so happy to have you here today.
Thank you so much.
So tell us, for anyone who is unfamiliar with ALS, kind of just break down the basics here of what it is.
So ALS, it stands for amyotrophic lateral sclerosis, and as you mentioned, also known as Lou Gehrig disease after the famous baseball player. It's a neurodegenerative disorder. That means the brain cell is dying, and these brain cells in charge of the motor function and the muscle function in our body. So it will result with muscle weakness at the hands, feet, and eventually they will have swallowing and breathing issues. We really don't know the cause of ALS clearly, but about 10% it's caused by genetic mutations. The prognosis of ALS, unfortunately, it's about 4 to 5 years after the first onset of the symptoms.
Wow. I mean, you described those symptoms, and that is life-altering for any person. And so describe kind of why these events, though, are so important going towards this research and helping to try to find a cure for this.
Yes, I mean, first, I would like to thank our Neuromuscular Center team. They're walking this coming Saturday to support the ALS community, starting from the front desk to the medical doctors. They are very dedicated to this goal. So the fundraising is very important to support the ALS Association. It provides direct care to our patient. It supports the ALS clinic in addition to research and clinical trials. At Austin Neuromuscular Center, we collaborate very closely with the National Neuromuscular Research Institute. It provides research and clinical trials to our patient with early access to therapies that some of them already been approved by the FDA.
That's wonderful. Is there anything that can make someone more susceptible to this or have it in their family or things to be aware of?
So as I mentioned, 10% is genetic. So there could be a chance one of your family have it, and then their kids also will have it. The only very well-defined risk factor is age. The peak is 60 to 70 years old, but generally after the age of 40, but we've seen some young population. The second also risk factor is smoking. Also, it's none. There is several other risk factors that really not fully established, like, for example, exposure to toxicity from heavy metals. Athletics also could have it, like soccer player and football player, repetitive head injuries.
Wow.
So there are some list of minor risk factors, let's call them.
That is so interesting to hear about as things kind of develop and go on. Well, thank you so much, Dr. Hussain, for being here today. And of course, this event Saturday at 9 a.m., is that right?
Yes, that's correct.